Very welcome to JPIAMR. And we are welcoming Professor Tom Harrison, who's a member of the JPIAMR Scientific Advisory Board. Very welcome, Tom.
Okay, thank you. Yeah, happy to be with you.
And we're happy to have you because we want to highlight the fact that there is a broadening of the SRIA. This is an acronym we're gonna have throughout this conversation, but it means the Strategic Research and Innovation Agenda of JPIAMR. And now in April, we incorporated antifungals as a research objective. And we would like to have a chat with you to have your expert view on the implications of incorporating antifungals. So we are very happy to have you with us.
Okay.
And just to dive into the conversation right away, now when antifungals as a research field was included in the JPIAMR SRA in April, we would like to have a little bit of your background because you're a member of the SAV, and tell us a little bit about your expertise in this field.
Fine. Okay. Thank you. Well, Anders, I'm a clinical academic, so that means I've spent most of my career, spent 50% of my time doing clinical work here in St. George's Hospital in South London, where we serve a very diverse population of people with lots of interesting infectious diseases. Including fungal infections, and the other half of my time on research matters. So me and my group over the years, we've been particularly interested both in the clinical challenge and trying to make a contribution in terms of research in serious systemic fungal infections. And I mean, these tend to be infections, I mean, not always, but they tend to be infections that affect patients with some form of immunocompromise or another. And the infection that we in particular have been studying as our group is called cryptococcal meningitis. So that's a fungal infection, a fungal form of meningitis. It predominantly affects HIV infected patients, but I mean, not exclusively. I mean, patients who are apparently immunocompetent can get it, but it's mainly HIV infected patients. And it's actually one of the major causes that people with HIV actually die. And it's now the commonest cause of meningitis across many parts of the world, particularly sub-Saharan Africa. So that's a fungal infection that causes, it's estimated about 180,000 deaths per year. And it's not going down. You know, some people think that HIV has gone away because of antiretroviral therapy, but unfortunately, there's still many patients present late when they're already sick. And also, every year, a few patients who are on treatment drop out of treatment because it's hard to stay on treatment lifelong. And then their immune system becomes weak again, and they become susceptible to these late-stage complications of HIV, including this form of fungal meningitis. And it's really a terrible infection. The mortality, the best estimate of mortality is around 70% at 3 months. So you'll probably appreciate that's the same, you know, that's the same, if not higher than the latest estimates for Ebola virus infection. So that's really, you know, really a big challenge. And treatment for this infection has been very hard, especially in low resource settings like Africa. So our work has been on trying to optimize the antifungals for the treatment of this form of meningitis. And we've had just three drugs, you know, which are kind of have good activity against this fungal infection. And we've spent some years doing a series of phase 2 and then larger phase 3 trials and managing to optimize the combinations and the dosages of the antifungals. And in our last trials, you know, getting the mortality down to the order of 25%. So, you know, really significant reduction in mortality through optimizing the use of antifungal drugs for this particular serious fungal infection. And then we've got other programs, of course, I mean, including strategies to diagnose the infection much earlier, before patients get sick. So we screen patients who are at risk, and we give them, we call it preemptive treatment, before they get sick. So that's another strategy. So that's the sort of work we've been involved in, and we're excited to be trying to carry it forward now and to implement it across the areas which have the highest burden of disease. But I think also some of these things that we've looked at, could have lessons for treating other serious fungal infections. So we're also working with colleagues in some of the other serious fungal infections that HIV patients get, and trying to take some of the approaches that we've used in cryptococcal disease to these other fungal infections. So that's just a little bit about our particular work and where me and my group are coming from in terms of antifungals. Yeah.
Excellent. Yeah, we can go down many paths here. There are so many questions. I'm curious about your research. And just to be clear here, antifungals is the treatments of fungal infections.
Yes.
And fungal infections, now this implies, of course, the topic we're interested in from JPIAMR perspective is the antimicrobial resistance. So here's the link that we see plays out for the research.
Yeah.
What do you anticipate now when the antifungal are included in the strategic research and innovation agenda of JPIAMR? What do you anticipate to be the impact on antifungal research in general?
Yeah. Well, I mean, I'm very excited about it, and obviously, I'm happy to to be on the advisory board and see some of these initiatives taken forward. I mean, I think that the one of the issues is there's no question that serious fungal infections are somewhat under the radar in terms of a challenge to human health, and so it's not just HIV patients. It's across the spectrum, and there are estimates that somewhere in the order of 1 million to 1.5 million people are dying from fungal infection globally every year. But it's just a little bit underappreciated, and it's certainly under-researched. And so this is where I think the JPIAMR initiative is really so important, because it's injecting, substantial extra funding, which is available to people trying to look at the issue of fungal infections and particularly antifungal resistance. Yeah.
And there we go with the importance of including antifungals in the strategic research. Since, like you're saying, it's kind of underfunded, the research, or under the radar, and also bringing antifungals into the JPIAMR framework in a way. Since JPIAMR is an international collaboration between 28 member countries, can you reflect a little bit on the inclusion of antifungal research actions could impact international collaborations in the field? Because as you're saying, this may be impacting differently in different areas of the world, and making collaboration happen when it comes to research. What's the impact here?
Yeah, well, I mean, of course, significant scientific progress. It's all about collaboration. And of course, we need to put together our complementary skills and people's skills coming from different angles. And so, I mean, of course, this happens already to some extent, but I really think the JPIAMR initiative is a tremendous additional opportunity to form international networks. And I mean, I know there are network grants as well as particular project grants. So clearly, I mean, I think that's vital. I mean, no one group has all the answers or all the resources. So it's vital that we work together. As you say, some of these fungal infections are a particular challenge in particular parts of the world, and we need to come together to work with our colleagues in areas affected by particular fungal infections. There's one called tularomycosis in Southeast Asia, really a big problem there. And another one called histoplasmosis, which is really very, very common in Central and South America. And North America, and so we need to come together, and this is a really good opportunity. Yeah.
And opportunities is also linked to money
Yeah.
to support the research. How do you see that? Will new possibilities be available for
Yeah.
researchers
Yeah.
for funding?
Yeah, I mean, we did in the UK, our own UK government, our MRC funding
Yeah.
agency have actually been looking at how much money, is being devoted to fungal research. And they've been aware of this as an issue for some time. I mean, but there's no question, even, the UK is, thank goodness, I mean, speaking for somebody within the UK,
Yes.
apparently second after the USA in terms of funding of fungal research, but nevertheless, it's a small percentage of the infectious disease research, never mind the total research agenda. So, the fact of having an additional initiative and funding available can make a significant difference, because we're talking about a relatively low baseline of funding currently. So that's where I think this could be significant.
And the strategic research and innovation agenda is divided into 6 priority topics, and the topic that costs the most money is therapeutics, kind of course. But what do you see when it comes down to fungals? What topic area do you see is important here to cover with research?
Yeah. Well, I mean, in general terms, of course, we need to hit this problem from different angles, and that's the way the program is set up, with these different research areas: therapeutics, diagnostics, surveillance, environmental issues, and so forth. And I mean, I'm sure all of them are important, and they're certainly all important from the point of view of tackling antifungal resistance. I mean, I should say that there's no question, as I think many people are aware of the challenge of antibacterial resistance. It's quite in the news, but antifungal resistance is also a growing threat. I mean, these fungal infections that I've mentioned, I mean, they are challenging to treat. Right. Despite the treatments that we have, mortality from some of these infections is usually in the order. I mean, I've mentioned for cryptococcal meningitis, 70% in Africa in routine care. Yeah. But even for some of the other common fungal infections, I'm thinking of Candida infection in the bloodstream and aspergillosis. This is an infection that affects immunocompromised patients, usually causes infection in the lung and sometimes in the brain of patients. I mean, the mortality from these diseases in the order of 30–40%. So they're difficult infections to treat. And then on top of that, we're seeing resistance to the drugs that we do have. So we have relatively few drugs already. We're talking about probably 3 major types of drugs, or drug classes. And now we're seeing resistance to even to these few drugs that we have. So, I mean, perhaps it's worth mentioning a couple of examples, because in the aspergillus infection I've mentioned, we are now seeing aspergillus isolates from patients which are resistant to the azole drugs. The azoles are probably the most important class of antifungals we have, and they're the current first choice for treating aspergillosis. But now, in different parts of the world, we're seeing significant rates of resistance to azole treatment of aspergillosis, and it affects the outcome. Patients who have resistant infections don't do as well, and it's probably the evidence now is that this resistance is coming from 2 places. I mean, patients who are treated with azoles, they can develop resistance to the azoles, because if they're on treatment for a long time, that's what we're kind of used to seeing. But in addition, now it's clear that patients can pick up aspergillus, which is already resistant to azoles, because these drugs are also used in very large quantities in agriculture.
Right.
to protect crops from fungal diseases.
Exactly.
The Aspergillus, like many of these other fungal infections that I'm talking about, they're environmental organisms. They're out in the environment. So the Aspergillus will be out in the environment, and it will be kind of sprayed as a bystander effect, if you like. But then, if there are spores in the air, that we all breathe in these fungal spores every day, and people breathe in a resistant infection, and they happen to be somebody who gets sick from that infection, then they've got resistant aspergillosis. So that's an example of increasing antifungal resistance, and there are others.
And now you're touching on something that is important here when you mention agricultural dimensions, and the One Health approach, this holistic approach that is central in JPIAMR's work to coordinate research funding and the research itself. How do you reflect on this when antifungals within this approach? How does it fit?
Well, I mean, I think it's vital, and I mean, I guess it comes down to the biology of these organisms, and like I've mentioned, I mean, the example of the Aspergillus resistance is probably the primary example at the moment that's causing us so much concern. So clearly that needs a One Health approach. I mean, we've obviously within the medical world, we've got ways forward that we need to focus on and tackle. We need stewardship, good stewardship of our antifungal drugs when we treat patients. To just use them when they're needed, target them to the patients who really need them, use them in combinations perhaps, and so forth, and find other ways of treating patients to support the antifungal drugs. But we need parallel program in agriculture, so that, I mean, nobody is, we must remember, we need food security as well. We need our crop production, but clearly, if there are ways in which the use of the azole drugs could be at least targeted or best practice used, so that we tried, and in future agricultural fungicides develop which are not used in human medicine, to keep the two sets of compounds separate if possible into the future. So we need to think definitely across sectors, and that's again where there's exciting opportunities, I think, within the JPIAMR approach.
Now we're going into a little bit of details. We mentioned the priority topics: therapeutics, diagnostics, surveillance, transmission, environment, and interventions. That is part of the SRA. And antifungals are inserted into each research topic. And if you, as a viewer, if you'd like to view these, we have posted the updated SRA, including antifungals, on the JPIAMR website, so you can read into it, because it's quite an extensive list of needs and gaps that are covered within these topics. And can you, as an expert, the most important gaps and needs, what is there something you would like to highlight? We've touched probably on these a little bit already, but can you mention something that you think is
well, I mean, surely, I mean, I think I could mention 2 or 3 things, I think, which are vital and which part of the program. I mean, I think maybe just start off with more surveillance, because this as we've said, the issue of fungal infection and antifungal resistance, we're aware of the increasing challenge, but we do need more data, and we need to be able to track that data. And there isn't the same degree of surveillance of fungal infections and antifungal resistance as there is for some of the better known bacterial infections. So that's surely a need. I mean, another need that we haven't talked about yet is diagnostics, because, I mean, if we go back to the infection that we particularly study in our group here, cryptococcal disease, we were we were lucky enough to be involved in helping to develop and test a novel, easy to use diagnostic test. We call it lateral flow. It's a kind of a dipstick test, very easy to use, 10-minute test, very suitable for resource limited settings, and very specific and sensitive. And that test for cryptococcal infection has really been revolutionary, and really, obviously help target treatment to the patients who've got the problem, and also target early treatment, before patients get too sick. So we really do, it would be marvelous if we had better diagnostic tests for the other common serious fungal infections. And I'd mentioned Aspergillus. That diagnosis is not easy. And Candida bloodstream infections. If we had better diagnostic tests for these infections, it will make a big difference, because you see currently, as you can imagine, because they're such life-threatening infections, because the traditional diagnostic tests, the traditional laboratory culture methods are quite insensitive and only come often positive later on when patients are already very sick. What doctors have to, often do is they're kind of pressured into treating patients, preemptively or empirically, when they're not sure that they've got infection, they could have the infection. And of course, that means a lot of patients are exposed to drugs who actually don't have infection. So this is the way in which better diagnostics could really make an impact and actually help us target our drugs. And that, of course, would mean that there tend to be less development of less resistance into the future. So I would highlight diagnostics. And I mean, we've talked about drugs, we've talked about the fact we don't have many. So, I mean, absolutely clearly, we need some more drugs. And in particular, we need some more drug classes. So I would please give me a wish. I think you were going to give me a wish at some point.
Exactly.
Give me a wish. Give me some better diagnostics, and also give me 1 or 2 new antifungal drugs. Now, and of course, that's again a major thing within the therapeutics angle. And there are, I mean, fortunately, there are 1 or 2 new drugs in development now, which look very hopeful and are new drugs. So I do hope that those drugs come through and are shown to be safe and effective. And then you see, at least we have some more tools in our toolbox, as it were, and we can look at the different combinations that may be optimal and may also, as I've mentioned before, in combination, you could protect the drugs from resistance to any one drug. I mean, that's a principle of treating infectious diseases that we've learned over the years. One way to prevent resistance developing is to use a combination. Right. So yes, a few more antifungal drugs would be great.
Seems like you already touched on the wish list, but it seems also like there is room for innovation.
Yeah.
In many ways.
Definitely. I mean, definitely. I mean, I'm not a drug developer. I'm not. I'm a kind of an end user,
right?
Of what companies come up with. But the innovation that's out there is exciting, and we've seen. I don't know. We've seen how modern biotechnology can come to the fore in the COVID pandemic.
Exactly. Yeah.
If we turn some of these capabilities that we have nowadays in terms of diagnostics and therapeutics to this challenge of fungal infections and antifungal resistance, I think we can look forward to innovative solutions.
But we also see the kind of networked effect when there's collaboration and there's actually kind of set platforms for research collaboration and networking, how important that is when you meet the challenge. Like it's easy to relate now to COVID when we are in the middle of it, but I mean, you can apply these methods.
I'm excited when you look at the map, you look at the global map of the JPIAMR partnership, which covers the globe.
Yes, almost. Well, it's 28 countries. There's room
Well,
for more, but
different parts of the globe are covered.
that's true. We're kind of we're touching on each continent, and we have a lot of engaged members. And also, I mean, we're including countries that are not members when we're working to like with aid agencies and so on. So there, I mean, there is also room for innovation when it comes to research collaboration.
That's good. That's important. Yeah.
I'm so happy to have you with us. I would like to ask you the last question that you touched on. If there were one big thing that you could wish for, that would be a game changer when it comes to fungal infections and antifungals. Is there something that comes to mind?
Gosh. Well, oh gosh, I'm gonna say three things.
Okay. Okay.
Say diagnostic for Aspergillus and Candida, and a couple of new drugs.
Yeah.
I know that's cheating. Sorry.
Okay. Wishing is fine. I think it's important to be able to have wishes.
Yeah.
And they may come true.
Yeah. Good.
Thank you so much, Tom, for spending time with us and sharing your knowledge.
All right. My pleasure. Yeah.
And we look forward to your work in the Scientific Advisory Board, of course.
Yeah. Okay.
Okay. Thank you.